there anything specific that has stuck out to you? Any specific, whether it be technology or a specific therapeutic innovation that has piqued your interest more than others? And if so, does this bring advantage? Which advantages does this bring towards the disease management of Parkinson's?
Yeah, I think it's a great question. The good thing is that we understand Parkinson's much more than we did even a decade ago. And this is not a small thing, because the more we understand the pathophysiology of an illness, the more we could create or test targeted therapies towards that. Whereas before, it was kind of just a crapshoot treatment. An example of this is someone has pneumonia, okay? Like for COVID, for example. We don't know, the virus we have identified. Let's say you have pneumonia and you don't know what it is yet. And so what are you going to do with a patient? Well, you're going to give them something to lower their fever. You're going to give them something to keep their hydration status. You're going to give them something for their muscle aches and muscle pains. You're going to give them something to suppress their cough. But you haven't done anything to get rid of the organism that's causing the pneumonia. That was where we were in Parkinson's disease. We were doing everything else. We were keeping them less rigid. We were giving them muscle relaxants, but we weren't attacking the source of the problem. Now we're understanding the source of the problem, and therefore now we are testing agents that can disrupt kind of that cascade of events that lead to Parkinson's disease or make Parkinson's worse by the day. So now what makes us excited is that, one, we've identified gene mutation that is responsible for some of the Parkinson's, not all of the Parkinson's patients, but for some of them. So about 5 to 10% of Parkinson's are familial or inherited. And we've identified those genes. So if we now develop agents that will attack those genes to prevent them from spreading or mutating more, then we essentially have a cure for it. And so we're in that era. Another area is we now know the abnormal proteins that's clumping and possibly causing Parkinson's disease. And so if we develop antibodies or agents that can corral these abnormal proteins and prevent them from spreading throughout the brain, then we've slowed Parkinson's disease or stopped it altogether. We're in that phase of testing those human monoclonal antibodies that can kind of segregate and prevent these pathological proteins from spreading throughout and doing their damage. And then if all else fails, we still have DBS, or deep brain stimulation surgery, which is probably our biggest medical surgical revolution in the last decade. The problem with DBS surgery, or deep brain stimulation surgery, is that it is brain surgery. One, it's expensive. Two, not everyone wants to have a hole drilled in their skull. And three, it's not something we can offer everyone. It requires a certain window where it is time to intervene with DBS surgery. Before that, it's too soon. Beyond that, it's too late. And so as great as it is, it can only be offered to a smaller subset of Parkinson patients. But there is now more and more advancements to DBS so that window is becoming larger. And that excites me, because that is living in the present while waiting for the cure, but we have to offer it to more patients. So our clinical trials are much more sophisticated now. They're much more ambitious as compared to before. A decade ago, our clinical trials were to stop the tremor, to make them looser, to make them walk a little better. But now we're addressing cognitive impairment. We're addressing slowing disease progression. We're testing more and more devices for advanced stages of Parkinson's disease, and so yeah, so we're fortunate, but we have a long way to go.